Good afternoon, Doctor. Thank you very much for your time. Welcome to the Midday View on ENCA. It's a very difficult situation, I guess, poorer countries that find themselves in, middle-income countries, low-income countries. I mean, the bulk of them, of course, we know they are on this continent, our African continent. How dire is the situation of the shortage of vaccines?
Well, good afternoon, and thank you for your invitation. Well, we have reached really a crisis situation. The situation has not improved at all. If we take globally, we have close to 2.7 billion doses of vaccine that has been made available and administered, compared to almost 42 million doses in Africa. So this is like a drop of water in the ocean. So we really need to see the supply pipeline improve in Africa, so that in the wake of this third wave that many countries are going through, the most vulnerable people can be protected as soon as possible.
Yeah, I understand the COVAX program has only delivered 90 million doses to 133 countries. I mean, that's really nothing. I wonder how much. I mean, that's not near enough to protect people.
Well, I think the COVAX, if we looked at the original idea in the setup of the COVAX, it was supposed to be a very equitable platform to supply vaccines to low-income countries, and mainly in Africa. But I think we've gone through, unfortunately, a lot of issues, particularly with the crisis that has hit quite hardly India, where we were counting on the vaccines that are currently being produced by Serum Institute of India. So that has absolutely affected the supplies pipeline. But at the COVAX, we are trying to diversify the portfolio of the vaccine by indeed bringing more additional vaccines in the portfolio, so that we can accelerate the distribution of the vaccine across the different countries.
Yeah, just the other day, President Ramaphosa here, together with the French President Emmanuel Macron and WHO, yourselves, Tedros Ghebreyesus, announcing this new hub that South Africa will be here. I mean, that's like still in the future. In your view, what can be done now to improve the situation, to deal with this vaccine inequality, or as President Ramaphosa has called it before, nationalism?
Well, let me first really acknowledge the major development that has been done in South Africa by the establishment of this hub to produce vaccine on the African continent. I think this is a major step forward in terms of ensuring vaccine independence for Africa in the future. You are right, this is not going to solve the situation in the short-term period. So what is really needed now, it's really to make sure that those countries, and particularly high-income countries that have got excess number of doses of the vaccine, make them available as soon as possible to Africa, so that we can also start to protect people. Secondly, we have seen a lot of good announcement in terms of donation by healthier country, but those donations have not yet been translated in concrete action to see doses starting to arrive massively in the continent. So we have two really areas to focus on. First, to increase the diversification of vaccine in the COVAX portfolio now, but also to make sure that the donation that have been announced can start to become a reality now, and to see the vaccines coming to Africa quickly and be administered in the arms of the people on the continent.
In the meantime, very briefly, Doctor, are you hopeful that we will see more vaccines being made available to the poor countries and developing countries, like many of them we have on our continent?
Yes. I think we are going to see a surge in the supply, particularly starting in the third quarter and accelerating in the last quarter of the year. So by the end of the year, we will definitely see a lot of supply coming to the continent. And really my appeal here is to all our countries to get prepared for that. So to fulfill the commitment made by Dr. Tedros to immunize up to 30% of all population by the end of the year in 2021.
Thank you very much. Merci beaucoup. That's Dr. Richard Mihigo there talking to us from the offices of the World Health Organization in Congo, Regional Office for Africa Program Coordinator.